So I'm here with Dr. Graham Pollett, who has announced his retirement after 18 years as the Middlesex-London Health Unit's Medical Officer of Health. How are you feeling after having made this decision?
I feel very good. I think it's the right time for me, and so having made the announcement and the decision being out there, I feel very good about it.
You've done a lot over your career. Looking back, is there anything that really stands out to you as a great accomplishment?
Well, my medical career is actually 39 years long, 29 years of which have been in public health, and so an awful lot has happened over that period of time. I can remember, for example, when I started, people still smoked at their desks at work. And so that accomplishment in terms of the smoking bylaws and now the provincial act, Smoke Free Ontario Act, have been wonderful accomplishments by public health advocates and by many community partners to achieve that. I've also seen tremendous changes from a communicable disease perspective. Each block of time seemed to bring with it a new communicable disease. There's herpes, hepatitis B, AIDS, of course, SARS, E. coli 015787, just as examples. I've also seen quite a few changes from an immunization point of view, and so that we can protect people. New vaccines for things like hepatitis B, human papillomavirus, or HPV. We now have a vaccine for shingles, herpes zoster, and even rotavirus, one of the most common causes of diarrhea in children. So just tremendous changes that have occurred over my 29 years in public health.
And advocating for smoking in public or non-smoking in public places and assisting Londoners to quit smoking has been a clear passion of yours. What makes that so important to you?
Well, smoking has been and unfortunately still remains the leading cause of preventable death and illness in Middlesex-London, Ontario, and indeed North America. And so wanting to address that from a prevention point of view has always been a passion and remains so. We have, for example, a position before City Council as we speak to extend the city smoking bylaw to include outdoor recreational areas.
And your term, I believe you're wrapping up in September.
Mm-hmm.
Do you have anything that you really want to accomplish before that date arrives?
No, just wanting to work with the Board of Health and with the staff here for a smooth transition. Wanted to give the Board of Health lots of lead time to facilitate them in their recruitment for a successor. So that's the main objective at this point.
What have some of the biggest challenges been throughout your career?
Oh, lots of challenges. From an administrative point of view, there have been budget issues over the years. We're going through another difficult time budget-wise. And then from a public health perspective, we've seen a variety of outbreaks of different diseases. We had a mass immunization campaign for a cluster of meningococcal meningitis cases, for example. It's interesting, when I first started in public health, health promotion was a new concept, it was a new practice, and it was all about having people become more engaged in their health. Now we see strong evidence that that's worked, because people want to be informed, they want to do their own research, they want to be involved. And so that's been very rewarding to see that transition happen among members of the public.
And in order to inform people, you obviously do need funding, which is a constant issue in any area, and in particular at the health unit.
Mm-hmm.
Do you see that becoming more of a challenge as the health unit goes on without you?
I think it'll be a challenge. Would have been a challenge with me here or without me being here. Yes, it's just the economic times the desire of council, the expressed desire of council to bring in a 0% property tax increase for at least another year, if not 2 more years. And so this impacts on all public services, and we are affected as our other community partners.
In your opinion, is there anything that could be changed to make the job of the Middlesex-London Health Unit easier or more efficient or more effective?
Not that comes to mind off the top, but we've had very strong support from the Board of Health, which is key. We have a very engaged Board of Health who investigate, explore the issues that are presented to us as an agency, and that has been so important over my 18 years here at the Middlesex-London Health Unit. Also very strong staff, senior staff and staff who provide our programs and services. So I believe I'm leaving the organization at a time when things are very well in place.
Do you have anyone in mind to succeed you?
No, I think that's a decision of the Board of Health, and so I'll be of whatever assistance that they would like me to be in helping them. But the final choice is their choice, of course.
And so your retirement is coming up soon. Do you have any plans for when you have a lot more spare time on your hands?
Well, I've always enjoyed gardening. I'm an avid golfer. Love to read. So those are the types of things I'm looking forward to. And I'll just see what happens. I don't have any fixed plans apart from those activities. I'm not someone who's planning to go from one career to another career. Just going to enjoy retirement.
Do you plan to stay involved in London's health community at all?
Yes, certainly plan to stay involved in London generally, because London is our home now. We plan on continuing to live here.
Well, thank you so much for your many years of service, and I wish you the best of luck in retirement.
Thank you.